Neutropenic sepsis is a life-threatening side effect of chemotherapy. Deaths occurring from this side effect are preventable. Many cancers are now potentially curable. However, patients can die from the side effects of treatment and not the disease.
Sweetheart, are you all right?
I'm not feeling very well.
What do you mean?
I'm just not feeling myself.
Do you have a temperature?
I think I might.
Maybe you should see the doctor. You know what the chemo nurse said about infection.
It's Sunday. There'll be no one there.
Look, I think you should get it checked out.
I can't. I've got to pick up Jacob and Liam from football.
I'll come home.
No, it'll take you a good 4 hours. Besides, they'll only send me home with more antibiotics like last time.
Nicola, at least speak to an out-of-hours doctor. Get some advice.
All right, I will.
And ring me when you know something. I love you, sweetheart.
Love you too. Bye.
Early signs and symptoms of neutropenic sepsis include pyrexia or hypothermia, non-specific symptoms of feeling unwell, symptoms of infection, shivering, feeling hot and cold, spontaneous rigor, and diarrhea. During the early phase, patients often look well.
Thanks for calling me back.
I understand you're not feeling well and have recently finished some chemotherapy. How long have you been feeling unwell?
Since I got up about 8 o'clock this morning.
Have you had a temperature within the last hour?
Yes, it's 37.5.
Mrs. Jackson, I'd like you to go to A&E as soon as possible. Your white blood cells may be low and you may have an infection. Is there someone who could drive you there?
No, really, I'm fine. I can drive. Thanks.
Mrs. Jackson should not have ignored her symptoms. She should have called the hospital the moment she felt unwell. Patients are given a 24-hour contact number by the chemotherapy department. Any patients with signs and symptoms of infection should be referred immediately for an urgent full blood count.
Oh, hello, Nikki. You all right?
I'm sorry, Becky. I've got to go to hospital. I'm not feeling very well.
Oh, dear. Is there anything I can do?
Can you pick my boys up when you collect Connor from football?
Of course.
And hold on to them till I get back?
Absolutely. Does David know?
Yeah, I spoke to him an hour ago. I'll call him again from the hospital.
Okay, love.
Thanks,
See you
Becky.
later. Bye.
Mrs. Jackson? Oh, hello. Would you like to come with me? So, Mrs. Jackson, you told me that you've been on chemotherapy and you haven't been feeling well since you got up this morning. And you spoke to an out-of-hours doctor who told you that you needed to come to A&E for an urgent blood test. Is that right?
Yeah.
Are you on any medication at the moment?
No. But I did take a couple of paracetamol a few hours ago.
Oh, okay. I think what we need to do is take you through to the treatment area. I'll do your temperature, pulse and blood pressure, and then we'll get those urgent bloods off. Okay.
Okay.
Be aware, paracetamol can mask the symptoms of infection, and neutropenic patients cannot mount a normal immune response to infection.
How are you feeling?
I feel a bit shivery.
All right, that's because your temperature's high. I'll get these bloods off as soon as we can. Okay.
Patients with neutropenic sepsis can deteriorate rapidly. They can go from feeling generally unwell to being seriously ill very quickly. To determine their immune status, blood tests need to be processed urgently and results chased within half an hour.
I'm so sorry I've been so long. It's been frantic today. How are you feeling?
I feel terrible.
Your white blood cells are very low. You're neutropenic. And that means we're going to have to transfer you to a ward and you're going to have some intravenous antibiotics. Okay.
Can you let my husband know where I'm going?
Yeah, sure. We'll get you going. Hi.
Hi.
This is Mrs. Jackson. She's a 42-year-old lady who had chemotherapy a week ago. She's got neutropenic sepsis. Her temperature's 38.5. She's got a slight hypotension and a slight tachycardia. She needs intravenous antibiotics. She needs her first dose. And she also needs cannulating because we haven't had time to do it downstairs. And she needs the drugs prescribing as well, please. But she needs these urgently.
The classic time for the development of neutropenic sepsis is 7 to 10 days post-chemotherapy. On diagnosis, IV antibiotics should be prescribed and delivered immediately according to the neutropenic sepsis policy. Antibiotics should be delivered within 1 hour of admission to prevent deterioration to the late stages of neutropenic sepsis.
Okay.
If you put Mrs. Jackson in B3, I would attend to that call, so I'll come back later. Okay, Mrs. Jackson?
Okay.
Mrs. Jackson had to wait for another hour before she received her antibiotics. Neutropenic sepsis is a medical emergency. Patients with neutropenic sepsis should be viewed as high risk and treated as a priority.
Your temperature's gone up. Your blood pressure's a bit low. How are you feeling?
I don't feel well at all.
Okay, I'll keep a close eye on you.
Thank you.
I'll come back and check your temperature again later.
Oh, nurse,
Yes?
can you just pull the curtain a bit?
Sure.
If neutropenic sepsis is not treated during the early phase, it will progress to the late phase. Signs and symptoms to watch out for include restlessness or confusion, feeling cold and clammy, hypothermia, hypotension, and tachycardia. The late phase, if untreated, can progress to organ failure and death.
Hello, Mord.
It's Mrs. Jackson's husband. I've just arrived home. I believe my wife has been transferred to your ward.
That's right, Mr. Jackson.
How is she?
Well, she's had her antibiotics. She was quite poorly, but she's having a rest now. Do you want me to get her to call you when she wakes up?
Yes, please. Can you tell her that the boys send their love?
Sure, we'll do.
Thank you.
Okay, bye. Mrs. Jackson? Mrs. Jackson? Mrs. Jackson? Somebody! Can I have some help here?
got the crash card. Is someone called the doctor? Neutropenic sepsis is a life-threatening side effect of chemotherapy. Act fast to prevent deaths. Use the heat trigger. History, examine, action, and treat. History. Is the patient on chemotherapy? When did they last receive treatment? Examine. Do they have any early or late signs or symptoms? Action. Cannulate and do an urgent full blood count. Chase the results within 30 minutes. Treat. IV antibiotics should be given according to the Neutropenic Sepsis policy within 1 hour of admission. If the patient is showing any late signs of neutropenic sepsis, for example tachycardia and hypertension, or appears very unwell, intravenous antibiotics should be given immediately without waiting for blood results.